Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in show notes. Today, we welcome back Tami Burdick. She's a patient advocate. She's the author of the book, Diagnosis Detective, Curing Granulomatous Mastitis. Today's KevinMD article is titled, Everyday Dangers Unknowingly Impacting Our Health. Tami, welcome back to the show.
Thank you so much for having me again.
So to hear Tami's story, she's been on multiple times, go to kevinmd.com/podcast. Find that search icon. You can search Tami's name to hear her story in prior episodes. But today, let's jump right into your most recent article, Everyday Dangers Unknowingly Impacting Our Health. Tell us, how did this one come together?
Yes, so I contracted granulomatous mastitis several years ago, and what we would find out through that journey is it appeared as if the environment was actually what caused that diagnosis, as a mostly associated environmental bacteria was to blame. And so that kind of fueled the fire within me to really learn about more about our environment, the potential dangers that are out there that many, including myself, were really unaware of.
Talk to me about more detail about how the environment, how the water may have contributed to your diagnosis.
Yeah. So when I was on a business trip, apparently the public water had been unknowingly contaminated. And there was also another gentleman on that same business trip who contracted this bacterial infection through his ankle, the same way that I did through my breast. Neither one of us had actually had an injury of any kind. So once we knew what bacteria that I had been dealing with, we were able to trace the origin, which was water, sewer, and soil, even though the bacteria did in research originate within the oral biome of a human. It can also be associated with goat milk as well. But after we were able to trace my steps and test the water in my own home, we were then able to really determine our confidence level in that business trip being the culprit for the bacteria. So I was kind of like Aaron Brockovich in a sense, where I had to trace my steps and kind of get everything all figured out. So, but it's not just bacteria, that we have to be concerned about. There's chemicals and whatnot in the water across the country. I don't know if you've ever heard of PFAS,
Mhm.
but they're carcinogenic chemicals that many of us are unknowingly bathing in and drinking every single day of our lives.
Now, did you trace back this contaminated water to, was it a some type of hotel? And how did you conclude that it was definitively from that source?
Yes. So, I didn't go and collect water samples from that area, but there have been multiple women in and around that radius that have also been diagnosed with GM. But the other gentleman on the business trip had contracted an infection through his ankle. But we diligently traced my steps. I had not been in any pools, spas, lakes, oceans, mud races, nothing of sorts. And once we did test for bacteria in my own shower, and it was negative for that as well as others through process of elimination. Like I said, our confidence level was pretty high in where I contracted it, and we were able to link it back to that trip. And what I did learn about that area in particular, there's a significant use of well water.
Mm.
So when you're looking at things like cisterine and well waters and things of that nature, there is potentially a higher risk of contracting those types of contaminants.
And this episode obviously set you on a trail to look for the dangers that we routinely face in the environment. So tell us some of your findings.
Absolutely. So I do actually have a background in home inspection. So have this general sense of how our own homes can actually be making us unknowingly sick with symptoms and, certain diagnoses. But when we come to our environment, there are a lot of opportunities for us to get sick from our environment. Things like ticks, like tick-borne illnesses. If you're out taking a nature walk or even walking through your front yard, we've got, like I said earlier, the different contaminants in public water, for example. There's even chlorines and there's PFAS and it's this whole journey that I went through with getting sick, from the environment really kind of set the fuel or set the fire for me learning more about potentially what could be out there making people sick. And
So, what are some common things that a typical homeowner should look out for You did mention things about whether it comes from well water. You did mention things like ticks. What would you say are some other common environmental hazards that we may overlook?
Yeah. So when it comes to your home, I will say this. If you're at home and you find yourself just kind of feeling this general sense of unwellness, but then you leave your house or you go on vacation and you start to feel a little better, that can be a red flag to you that, hey, maybe there's something in my home that I'm getting exposed to that's making me feel unwell. Or maybe most of the members of your family are sick, or maybe even your pets aren't that in great of health. And so when we look at that, that could kind of be like a red flag that maybe you should look into things a little bit further. I think a lot of new homeowners in particular really don't understand that a home inspection is more generalized. Most home inspections don't include a lot of things that homeowners should be testing for, such as mold, volatile organic compounds, radon, and a lot of these things can be making people sick and they may not even know it. And even mold in particular. A lot of people think, well, if I don't see mold, the mold's not there. But mold can be hiding almost anywhere. And mold spores release mycotoxins. And it's actually those mycotoxins that can make people really sick, especially those with genetic expression that could be making them in particular feel the effects of that worse than somebody else.
So let's say someone listening to you now fits that exact scenario where they feel better after leaving the house and they may suspect that there's something going on. So when you say look further, what are some
Yeah.
tangible next steps that they should immediately do?
Yeah. So obviously, they can hire a professional to come in. There are professionals who are certified in testing for radon, which can actually be responsible for causing lung cancers, especially in those who have never smoked a day in their life. They can be looking to hire a mold inspector who is certified in looking for mold. And they can obviously do other things like volatile organic compounds. So it's really hiring a trusted, reputable professional to come in and help you look for these things. Because, like I said, you might not see them, but they can be there.
Now you're a patient advocate. So how about if someone were to go to their primary care physician or to a clinician and say they suspect some type of environmental exposure? Are there any tests that you would advocate for or that you would ask this patient to ask their clinician to do?
Yeah. So I belong to a lot of different health groups on social media, and it's really a struggle to get these clinicians or healthcare professionals to really kind of think outside the box. I think most often they're going to say, well, go ahead and test your home. They're not going to be so inept to want to be able to start running XYZ testing on you. And perhaps, their generalized blood work may look normal, but the patient genuinely just doesn't feel good. And so it's kind of difficult sometimes, if you go to your clinician or healthcare professional, like I've got all these symptoms. And, I even went through something like that years ago. We found mold in my condo and I had all sorts of symptoms. And I was getting referred to all of these different specialists. I really was going through the circular door of doctors, and I'm just like, I'm not a hypochondriac. Like, I'm genuinely not feeling well, like something is wrong. And, it took some time, but there was actually mold that was in my attic that was contributing to all of my random crazy symptoms. So,
Any specific specialists that you've heard in these health groups that some patients may have some success getting to listen to them?
yeah, so functional medicine practitioners in particular are really great at looking for different types of testing that they can use to help these patients identify, okay, is this person dealing with mycotoxin illness or is this person dealing with Lyme disease? You can easily be tested for Lyme disease through your actual PCP. I don't know why it would be a struggle if the patient clinically presents with symptoms, or maybe they knowingly have been bit by a tick before. There are specialists out there who work with mycotoxin illnesses or mold illness in particular, like Dr. Shoemaker has been a very known individual to help patients with mold illness in particular. And there is actually a segment on the former show Monsters Inside Me about that, where a couple actually bought a new home. They had lived there for like 6 months. They both started having all of these random symptoms. They didn't feel well. They knew something was wrong. Lo and behold, they had aspergillus in their home.
Now, short of hiring a professional to go over your home, are there any everyday things that people can do? Maybe buying an air purifier or filtering the water. Do those have any utility at all?
Absolutely. So you can actually test your own water for over 150 contaminants. There's an at home test that anyone can be able to test their own water with. Air purifiers are great. So they make more of a full home house air purifier. And there's also single room air purifiers that you can buy. You can also talk to reputable HVAC companies where you can look at upgrading your HVA systems. There's certain different types of lights and filters that can help. You can clean your ductwork. If you do find mold, you can have it professionally remediated. So definitely there are things to help make your home more safer and be more aware of the everyday products actually that you're using in your home. A lot of these chemicals and stuff that we're using are very toxic. So I actually switched to a kind of more of a natural, organic, holistic way of kind of running my household. So
So, what are some common everyday products that are culprits for environmental toxins? Are we talking about soaps and detergents and fabric softeners and stuff?
absolutely. Actually, dryer sheets is a big no-no. They're probably one of the worst culprits when it comes to essentially making your home unhealthy. Burning candles is another way. All of the different types of plugins, that have all those crazy scents, detergents, different types of cleaners. So just be a little more self-aware. There are apps out there that you can actually download that will help you make better choices when it comes to using certain products in your home and even personal care items too, things like toothpaste and different soaps that we're using and lotions. Just be a little bit more mindful. Read ingredients, know what those ingredients are.
In your article, you talk about some people who have a genetic predisposition to environmental
Yes.
toxins. So, tell us more about that.
Yeah, so there's HLA genes. I actually have a gene in particular called the MTHFR gene. So it affects your methylation. It can also interfere with your body's own natural detoxification pathways. So there's certain genes out there that can make it more problematic for certain people when it comes to everyday dangers that might be lurking in our own environment or our homes.
We're talking to Tami Burdick. She's a patient advocate and she's the author of the book, Diagnosis Detective Curing Granulomatous Mastitis. Her KevinMD article today is titled Everyday Dangers Unknowingly Impacting Our Health. Tammy, tell us some of your take home messages that you want to leave with the Kevin MD audience.
Yeah, so if you've got all these random symptoms, if you think something might be wrong, don't feel like you're alone. Don't feel like you're crazy. But there are tools and resources out there that you can use and use them. So be your best advocate always. That's what I tell everybody. You know your body better than anyone.
Tammy, thank you so much for sharing your story time and insight. And thanks again for coming back on the show.